Hello everybody, welcome to my channel The Cowardly Doctor. Today we are gonna discuss the chapter 15, which is the endocrine pathology. So let us start with the anterior pituitary gland. Before watching this video, please make sure to like and subscribe my YouTube channel. We know that the pituitary gland is divided into two parts, the anterior part and the posterior part. Here we can see pituitary gland. Here is the anterior lobe, and here we can see the posterior lobe. Above we can see the hypothalamus. So the pituitary gland is divided into two parts, one the anterior part and the second the posterior part. In this topic we are gonna discuss two main things. Number one, the pituitary adenoma, and the number two, the hypopituitarism. So what is pituitary adenoma? The pituitary adenoma is a benign tumor of the anterior pituitary cells, whereas the hypopituitarism, it is the underproduction of the hormones which are released by the pituitary gland. Before studying about pituitary adenoma, we need to know what the adenomas are. Here we can see a adenoma. What are adenomas? Basically, the adenomas are non-cancerous tumors. They may grow along adrenal gland, parathyroid gland, or pituitary glands. Now we will discuss the classification of the adenomas. The adenomas are classified into number one, the functional adenoma, and number two, the non-functional adenomas. So what's the main difference between the two of them? Basically, the functional adenomas produce hormones, and the non-functional adenomas, no hormones are produced. In the non-functional tumors or adenomas, we know that no hormones are produced. Now the important high yield point is that they are often present with mass effect. Now what will happen if there are non-functional tumors present? There can be either be headache, there can be hypopituitarism, which we will discuss later in the video, and it occurs due to the compression of the pituitary tissue. And number one, the bitemporal hemianopsia. The bitemporal hemianopsia occurs due to the compression of the optic chiasm. Now what is the optic chiasm? So what is optic chiasm? The optic chiasm is the place in the brain where some of the optic nerve fibers coming from the one eye cross the optic nerve fibers from the other eye. Here, as we can see, is the optic chiasm where the optic nerve fibers from one eye are crossing the optic nerve fibers from the other eye. The compression of the optic chiasm will cause the bitemporal hemianopsia, in which there will be loss of vision in the other half of the eye. No vision and no vision. Now we will discuss the hormones of the pituitary gland. As we know that the pituitary gland is divided into two parts, number one, the anterior part, and the number two, the posterior part. The posterior part secretes three hormones, number one, the arginine, vasopressin, number two, the oxytocin, and number three, antidiuretic hormone. These hormones we will discuss in the next video. Whereas the anterior pituitary gland secretes seven main hormones, number one, the growth hormone, number two, prolactin, number three, thyrotropin, number four, adrenocorticotropin, number five, follicular stimulating hormone, number six, luteinizing hormone, number seven, beta lipotropin. So the important point to note is that these two hormones, the prolactin and the growth hormone, cause the most common functional adenomas. Now we will discuss the most common functional adenoma, which is the prolactinoma. What is a prolactinoma? A prolactinoma is a non-cancerous benign pituitary tumor. It produces a hormone known as the prolactin. In the prolactinoma, the prolactin will increase in the blood. An important point to know is that prolactin is involved in the milk synthesis. Prolactinoma in female will cause galactorrhea and amenorrhea, whereas in males it will cause decreased libido and the headache. We note that the prolactinoma will cause galactorrhea and amenorrhea in females. So what is galactorrhea? Galactorrhea is a milky nipple discharge unrelated to the normal milk or production of the breastfeeding, whereas the amenorrhea is the absence of the menstruation. So important point to note from this table is that prolactin will inhibit the gonadotropin releasing hormone. If there will be no gonadotropin releasing hormone, there will be no FSH and there will be no LH. So for the treatment of the prolactinoma, we use the dopamine agonist because they decrease the prolactin as well as the TSH. For the treatment of the prolactinoma, we use the dopamine agonist which decreases the prolactin. If there will be no prolactin, there will be no prolactinoma. Also, the surgery can be used for the treatment of the prolactinoma. Now we will discuss the second most common functional adenoma, which is the growth hormone cell adenoma. So this growth hormone cell adenoma will cause gigantism in children as well as acromegaly in adults. An important high yield point is that the secondary diabetes is also present in growth hormone cell adenoma. This is important high yield point. So following are the signs of gigantism in children: increased linear bone growth, the epiphyses are not fused, whereas in case of acromegaly in adults, the following signs can be seen. Number 1, enlarged tongue. Number 2, increased or enlarged hands, feet and jaw. And number 3, growth of the visceral organs, for example lungs and heart, and they could lead to the heart failure. Now we will discuss that how the growth hormone cell adenoma is related to the secondary diabetes. The important point to remember is that the excess growth hormone, it will decrease the glucose uptake into the cell, causing that secondary diabetes. So it will, number 1, it will stimulate the gluconeogenesis as well as the lipolysis, which will cause the hyperglycemia as well as the elevated free fatty acid levels. Number 2, it leads to the hepatic as well as the peripheral insulin resistance. Conversely, the insulin growth factor 1 increases the insulin sensitivity. So the growth hormone cell adenoma will lead to the secondary diabetes. Now we will discuss the diagnosis of the growth hormone cell adenoma. There will be elevated growth hormone as well as the insulin like growth factor 1. Number 2, the oral glucose will suppress the growth hormone or inhibit the growth hormone, but the important point to know is that the oral glucose will not work in case of growth hormone adenoma. For the treatment of the growth hormone cell adenoma, we use number 1, the octreotide. It suppresses the growth hormone. Also we can use the growth hormone receptor antagonist, and surgery may be used for the treatment of the growth hormone cell adenoma. Other rare functional adenomas include the ACTH adenomas. They can cause the Cushing syndrome. We will discuss about the Cushing syndrome in other video. They can also cause the TSH producing adenoma. They can also cause the FSH producing adenoma. They can cause the LH producing adenoma. Now we will discuss the hypopituitarism. It is a non-functional adenoma because no hormone is produced. Point 1, there will be insufficient production of the hormones by the anterior pituitary gland. Number 2, the symptoms arise when greater than 75% of the pituitary parenchyma is lost. Now we will discuss about the causes of the hypopituitarism. So the first cause is the pituitary adenomas in adults, or maybe the craniopharyngioma in children. Number 2, it may be Sheehan syndrome, which we will discuss right now. It is related to the pregnancy and it is the infarction of the pituitary gland. The main point to know is that it is related to the pregnancy. Then the third point is the empty sila syndrome. It is the congenital defect of the sila. Now we will discuss the causes of the hypopituitarism in a little bit more detail. The cause 1 was the pituitary adenoma in the adults or the craniopharyngioma in the children. So what will happen is that they occur when the pituitary adenoma increase in size and they compress the normal pituitary. So what will happen is that there will be loss of tissue of the pituitary, or it can cause pituitary apoplexy. In the pituitary apoplexy, what will happen is that there will be bleeding, blood into an adenoma. Sheehan syndrome. Now we will discuss the third and the last cause of the hypopituitarism, which is the empty sila syndrome. It is the congenital defect of the sila. So let's say here we can see a sila. The pituitary is sitting inside the sila. So the sila will compress and the pituitary is destroyed. So what happens in this empty sila syndrome is that sila is empty, the pituitary is absent, there is herniation of the arachnoid as well as the CSF into the sila. This sila will compress and the pituitary gland is destroyed. Thank you for watching the video. Please like and subscribe my YouTube channel.